Hello, welcome to Hematology 2 and we will discuss special evaluation of hemostasis. And kung mapapansin nyo, recall ito ng mga topics from prelims and midterms, and we will try to apply the following laboratory evaluation test for depending on the problem, no? Kung may ang disorder ba nasa primary hemostasis, secondary hemostasis such as thrombosis, or finally yung para sa fibrinolysis. A patient may came in with a different kind of chief complaint, no? Minsan hindi sila magreklamo about bleeding and thrombotic episode. Magreklamo sila in other stuff. And malalaman mo na lang yung na may ganito silang problem during your physical examination or kapag nakapag-start ka na mag medication. Usually at that second day, third day, doon mo na makikita, no? May bleeding tendency pala to. May thrombotic attacks pala ito. Okay? So it's very challenging for the clinicians to know such things. Lalong-lalo na naka-cater ang ating mga laboratory results kung anong na-feel ng pasyente. Hindi natin pwedeng lahat i-request, unlike sa ibang bansa, lalo na sa US, pagdating ng patient, lahat ng laboratory pwedeng i-request. So, hindi tayo ganon dito sa Philippines. Lalo na darating ang pasyente mo, walang budget yan. And sobrang mahal ng medical care dito sa Philippines. Okay, so ang clinician, ang goal niya talaga is to have a better history taking. You take into account the patient's age, gender, clinical signs and symptoms, no? Ano ang nangyari din sa past, na-confine ba siya, na-diagnose ba siya with a disorder, or nagtitake ba siya ng medication. Yan lahat ay lalagay doon sa past medical history. Plus, ito ang importante, no? And ang hirap kuhain ng information, yung family history. Kasi madalas, no, yung mga ninununuan natin, hindi naman yan nagpapacheck. No? Hindi eventually nadadiagnose ng tama. And usually, this bleeding and thrombotic disorders are associated with a bigger problem. Okay? Nag-DIC ba to? Dengue na pala, no? Nagta-thrombotic attacks such as yung stroke, yung pala, uncontrollable yung kanyang cholesterol. Okay? So, hindi natin tinitreat ang laboratory result paper. Okay? Hindi natin yon ginagawa. Ang tinitreat natin kung ano ang cause of the evil cause. Okay? Yung pinaka-problema. And kapag na-treat mo yon, domino effect na yan. Okay? Pag na-treat mo yon, matitreat na rin yung bleeding and thrombotic attacks ng pasyente. So, in laboratory diagnostics, hindi natin nga lahat ginagawa. Okay? Nakakiter yan kung ano ang instinct mo. Remember, the laboratory testings are not done to diagnose a patient. Kino-confirm lang ito yung nauna mo ng mga diagnosis or differential. Okay? Nagre-rely ka pa rin kung ano ang signs and symptoms ng pasyente. Sa disorders of primary hemostasis, pwede kang mag-request ng mga platelet studies and the blood vessel studies such as your bleeding time and your capillary fragility test. Remember, your primary hemostasis involves the integrity of the blood vessels and the counts and function of your platelets. So, sa bleeding time, yun ha. Kasama dyan ang platelets and capillary integrity. Okay? Sa disorders of secondary hemostasis naman, no, ang pinaka-routine lang na ginagawa dito, hindi ito lahat madalas ginagawa sa hospital. Minsan wala ito sa mga hospital. Ang madalas nyo makikita is yung mga coagulation studies such as your PT and APTT. And yun nga, madalas ito ginagamit to determine if there is a problem in the coagulation factor. Or ang pinakamadalas, no, most common use ng mga PT and APTT is for the pre-op evaluation or the pre-operative evaluation. Bago ma-opera yung pasyente, kailangan mo ma-request yung dalawang test na yon. Kung mag-bleeder ang pasyente, you may not opt to continue the operation or mag-ready ka na ng mga whole bloods for transfusion kung kailangan na talagang buksan yung pasyente. And then next, ito na yung mga pang-research study na siguro itong mga to. Okay? Kung na-identify mo na merong tayong problem with the coagulation process, pwede kang mag-specific coagulation factor determination through your substitution studies. I-discuss natin to thoroughly mamaya, no? Medyo matatagalan tayo dito mag-discuss. And then for mixing studies, nadaanan natin to during the disorders of thrombosis, no? Lalong-lalo na the number or the most commonly associated with thrombosis is your APAS or the antiphospholipid antibody syndrome. Ang D-dimer naman ginagamit for DIC and to rule out your venous thromboembolism. So, hindi rin ito madalas kina-request, no? Madalas ang evaluation lang is the physical examination and history taking of the patient kasi sobrang mahal ng ng test na to. And then globulin catalysis time, na-discuss natin to during the disorders of the fibrinolysis. Kapag hyperfibrinolytic ka, hindi ka prolong ang ECLT. Okay? And then kapag gusto mo naman talagang meron kang assurance kung ano talaga yung protein na nawawala, pwede ka mag-specific protein assay. Kung ang gusto mo malaman is yung levels of the plasminogen, levels of your TAFI, the Kunitz, pwede ka dito sa mga assays na to. And this is only being used for research studies dahil sobrang mahal ng mga test na to. Okay, so let's start with the platelet studies, which includes number 1, platelet count. The normal value would be 150 to 450. Okay, in other books, 200 to 400 or 150 to 500. Significant bleeding will start in levels of less than 60. Okay? Dito na magkakaroon ng uncontrollable bleeding ang pasyente. Okay? And then, kapag nakita mo na to, you would start to request for platelet concentrate, yung mga ganyan, para lang ma-replenish yung kulang na platelet count. And then, the most serious site of bleeding, which is hindi mo na talaga mahabol, is yung mga intracranial bleeding, no? Which may happen in stroke patients. Pumuputok yung ugat and then nagkakos ng bleeding. We have two methods for platelet count, which is number 1, indirect, number 2 is direct. So indirect count, you take into account your RBC counts as well, no? Number of platelets sa blood smear, multiply the RBC count over 1,000. And then sa direct methods naman, no, pwede kang gumamit ng tatlong types of strategies. Riss-Ecker, Guy and Lick, and Brecker and Cronkite. The difference between the three, only Brecker and Cronkite is to be done using phase contrast microscope. Okay, sa platelet functionalities naman tayo. Pwede mo i-test yung platelet adhesiveness through the glass bead retention test. And madalas to ginagamit in von Willebrand factor deficiency. And yung expected results is, di ba, yung von Willebrand, kasama yan dun sa platelet adhesion process. So, decrease ang platelet adhesiveness in von Willebrand deficiency. Next, your platelet aggregation. Ang apat ang ginagamit na reagents dyan, no? Ang mnemonics natin is RACE, histocitine, ADP, collagen, and epinephrine. And you would want to use a platelet-rich plasma as your specimen to fully test the aggregation ability of the platelets. And paano ka magpe-prepare ng ganyan? Use centrifuge at 200 RPM for 10 minutes. So, hindi ganun kabilis, no? Para hindi bumaba lahat ng platelets dun sa dun sa mga settled sediment sa baba. Okay, next is gut retraction time, which is a test for mainly for primary hemostasis, and pwede rin siya for secondary hemostasis, lalo na if you would want to determine the levels of the fibrinogen. Okay, so both primary and secondary din siya, pero primarily dun siya sa platelet function. Okay? So abnormal CRT would happen in number 1, thrombocytopenia, no? Low and abnormal fibrinogens. Ano ba ang tawag sa abnormal fibrinogens? Yung mga dysfibrinogenemia, okay? Ito yung mga nagko-cause naman ng thrombotic episode, no? Dysfibrinogenemia. And then next, yung mga abnormal proteins, which is present in paraproteinemia or the multiple myeloma. Ano ba yung mga abnormal proteins in multiple myeloma? Diba, severely increase yung mga immunoglobulins natin. And then lastly, your Lanzmann thrombasthenia, no? Pwede mo rin gamitin ang clot retraction time. So we have so as a recall, we have 3 types of methods in clot retraction time. Pwede kang mag-castor oil or Hirschbeck method, Stefanini, and McFarland method, which is a more specific or a more accurate method for clot retraction time as compared to the previous two. Yung difference nung tatlo, is that sa Hirschbeck, observation lang ng presence of the dimpling or the droplet-like serum. Sa Stefanini naman, inaantay mong mag-observe yung retraction time, no? Measured at ang time after 1 hour, after 2 hours, after 16, after 18 hours, and after 24 hours. And ang expected result is that the retraction time will begin at hour number 1, no, sa first hour, and it will be completed after 24 hours or 18 hours. So, ang mga abnormal result naman natin is, yun nga, ang completion is either less than 18 or more than 24 hours. So, ang mga abnormal, lalo na yung mga thrombocytopenia and abnormal or low fibrinogen, after 24 hours ang kanilang retraction time. And then, ito nga yung mas accurate na test is the computation, and mas mabilis, no? The computation of the CRT using McFarland. So, if you want to assess the platelet at the same time, the vessels then, no? Pwede kang mag-bleeding time and CRT or the capillary resistance test. So, sa bleeding time, pwede mong gamitin dyan yung itong mga methods na to, Duke method, IV method, and template bleeding time. And it will depend on the way or the procedure. Sa Duke method, ang gagamitin mo is the fingertip or earlobe. Sa IV method naman, kailangan mong gumamit ng sphygmomanometer para ilagyan ng pressure yung mga blood vessels kung puputok ba sila or hindi. And then sa template bleeding time naman, gagamit ka ng surgical or simplate, which is parang lancet yung mga yan, and with a specific depth ng needle. Okay? So sa mga normal values naman, Duke method 2 to 4 minutes, IV method 1 to 9 minutes, and template bleeding time is 2 to 9 minutes. Sa capillary resistance test or tourniquet test or Rampil lead test, gagamit ka din ng sphygmomanometer, no? And this time, mas mataas ang kailangan na pressure mo, 100 mm mercury for 5 minutes. Tapos, observe mo kung ilan yung mga capillaries na nag-give in dun sa pressure na yan. Okay? The normal grade is 0 to 10 petechiae only. Okay. Next naman tayo, mga coagulation methods naman natin. So, unahin natin sa pinakasimple, the clotting time. So, obsolete test na to, hindi na to ginagawa sa laboratories, pero aralin din natin yung aspects niya. No? We have 3 methods. We have capillary blood method, slide or drop, and whole blood or Lee and White method. So, sa capillary method, meron tayong capillary tube, okay? So, mag-aspirate ka ng blood dyan sa ating capillary tube, and every 30 seconds, binibreak mo yung capillary tube into 2 to check for clot formation. Kapag na-break mo na yung dalawang, halimbawa ito, binrake mo after 30 seconds, no? May string formation dun sa dalawang edges. Ibig sabihin, positive na yan for clot. So, matatapos na yung ating yung time mo dun sa test na to. Next naman yung slide or drop method. Diba dun sa slide, you will drop 2 drops or 3 drops of blood, and then i-check mo for clot formation using a lancet or yung ating feather lancet. Okay? Lalaruin mo yan, no? Kapag may string formation na dun sa ating lancet, ibig sabihin, positive na yan for clot. Next naman, ang whole blood or Lee and White method is also called your tube method. Kasi gagamit ka nga ng madaming blood dyan. Okay? Actually, ano yan? Series of blood specimen. So, i-check mo yung clot formation after 30 minutes, after 1 hour, after 2 hours, yung mga yan. And ang ating normal value, 7 to 15 minutes. Next, dito na tayo sa madalas ginagamit sa hospital. So, unahin natin ang PT, your prothrombin time, which is for extrinsic and common pathway. Extrinsic, again, your 3 and 7. Common, 10, 5, 2, and 1. And again, this is used to monitor your warfarin toxicity, no? Together with INR. So, paano ginagamit ang PT, ang prothrombin time method? So, kailangan mo specimen is a platelet poor plasma or PPP. To prepare this, you have to centrifuge your specimen at 2,000 RPM for 10 minutes. And then add thromboplastin as a reagent and calcium chloride. Mag-start ka lang mag-time after the addition of your calcium chloride. Okay? And the normal value is 10 to 12 seconds. Next, your INR or International Normalized Ratio. Ginagawa siya coincide with na kasama in parallel with prothrombin time kasi it is used to standardize the results. Meron kasing mga um, inherent errors regarding sa reagent and yung mismong machine itself. So, kailangan ginagamit ito to double check your results. So, ito rin ay kino-compute using this formula. So, una, kukunin mo muna yung PT results ng pasyente against the PT result of your control or the normal in society. Okay? Raised to the level of your ISI or the International Sensitivity Index. Sino ang magsaset nito? Yung WHO standard dun sa reagent. Kasi iba-iba nga yung reagent natin. So, huwag kakalimutan yung formula. PT ng pasyente over PT of a normal individual raised to the power of ISI. APTT naman, activated partial thromboplastin time. So, ito naman, it determines the levels of the clotting factors of intrinsic pathway and common pathway. Intrinsic pathway, kasama dyan yung 12, 11, 9, and 8. Common pathway, 10, 5, 2, and 1. It is specifically used for, actually, heparin therapy. So, ano yung mga reagents natin? Kaya tinawag siyang activated partial thromboplastin time kasi it uses activators such as kaolin, ellagic acid, or seline. Okay? These activators activate specifically your clotting factor 12. Kasi hindi na tayo gumagamit ng glass tube. Okay? Pag hindi tayo gumamit ng glass tube, hindi na-activate si 12. So, kailangan mo gumamit ng reagent to activate the clotting factor. Okay? The normal value mas mahaba, 25 to 35 seconds. Stiff vent time naman or your Russell Viper venom time, and this is specific for common pathway lang, which is your 10, 5, 2, and 1. Reagents natin dyan, from the name itself, no? Russell Viper or Vipera russelli or East Indian Viper. So, ito naman, ina-activate niya yung factor 10, which is the starting point of the common pathway. Another special test is your DRBVT or Diluted Russell Viper Venom time. Ito naman, to detect your lupus anticoagulant na makikita sa anong sakit? Sa APAS or Antiphospholipid Antibodies Syndrome. So, mamaya didiscuss ko yan. Next test is your thrombin time. Okay, sa thrombin time, hindi dinidetect yung mismong thrombin. Okay? It is actually a misnomer. Ang tinidetect niya is actually the formation of the fibrin from fibrinogen. So, mas focus niya ang levels of your fibrinogen. Ginagamit lang na reagent is the thrombin. Remember, thrombin is the activated clotting factor 2 para ma-activate si clotting factor 1. So, ang focus dito is yung fibrinogen levels. Kaya, affected ang thrombin time in these situations. Hypofibrinogenemia. Hypo means mababang levels of your fibrinogen. The presence of your FDP or FSP. Ano ba yung FDP? Your fibrin degradation products. No? Na kasama after ma-form si fibrinogen. Your thrombolytic agents, no, kapag nag-anti-thrombotic medication ka, isa dyan yung streptokinase, ginagamit yan sa heart attack and stroke. And also your heparin therapy. Next test is reptilase time. Halos kamukha siya ni thrombin time. You detect the activity of your clotting factor 1. So, dito naman, ang reagent mo is Reptilase. Reptilase is derived from the venom of your Bothrops atrox snake. Okay, so madami na tayong snake. Ang Russell Viper venom sa Stiff Ventime. Ang Reptilase naman sa Bothrops atrox. Dito naman, affected ang reptilase time in the following situation. Dysfibrinogenemia. Anong alit ang dysfibrinogenemia? Ito yung may excess or abnormal fibrinogens. Hypo naman kapag decrease, the presence of your fibrin degradation products, and the difference is unaffected ito ng heparin therapy. Okay, so hindi siya pwedeng gamitin to monitor heparin therapy. Okay. I-differentiate natin yung paggamit ng thrombin time and reptilase time. Okay? Sa thrombin time, kapag may dysfibrinogenemia ang pasyente, magiging normal, no? Kasi hindi niya kayang ma-detect yon. Sa reptilase time pa lang siya magiging abnormal. Sa hypofibrinogenemia naman, both are prolonged in both tests. Antithrombotics, no, yung ating mga streptokinase, prolonged sa thrombin time, normal sa reptilase time. Heparin therapy, prolonged kay thrombin time, reptilase time, normal. So, mas okay sa heparin therapy monitoring si thrombin time. Next test is urea solubility test or Duchert's test. And ito lang ang test for your factor 13. Okay, dahil from the name itself, urea solubility test. So, mga reagents mo, no, either your 5 moles of urea, okay, solubility, no, para malusaw mo yung tawag dito, yung ating fibrin clot, you have to use either yung urea or acids. So pwede kang gumamit ng 1% monochloroacetic acid or 2% acetic acid. So the normal value should be the clot must be insoluble to urea at 24 degrees Celsius. Yan ang normal. Kapag may deficiency ka niyan ng fibrin stabilizing factor natin, hindi stable ang clot. Madaling malusaw sa urea. Okay? Yun ang expected results kapag may deficiency ka ng factor 13. Okay. Try natin isolve yung mga problems na to. Kapag prolong ang PT, normal APTT. Okay. Prolonged PT affects your extrinsic and common pathway, right? Si normal APTT, APTT determines your intrinsic and common pathway. Kung prolong si PT at normal ang APTT mo, tanggal na si common pathway. Okay? Kasi nag-normal siya dito sa APTT. Tanggal na rin ang extrinsic pathway mo. So, matitira na lang is extrinsic, which is either your 3 and 7. So, most probably 7. Okay? Kasi ang 3 hindi kayang i-measure dito sa PTT dahil ang tropoplastine is actually your reagent. Next naman, normal PT, prolong EPTT. Okay? Tanggal na si common pathway kasi nag-normal siya sa PT. So, tanggal din si extrinsic. The problem lies in your intrinsic factor. So, the problems should arise in the following factors. Your 8, 9, 11, or 12. Next naman, prolong PT, okay? Prolong EPTT. So, saan ang problem? Ano ang common denominator ba nila? Your common pathway. So, the deficiency is derived from the either your 1, 2, 5, and 10. Next naman, normal thrombin time. Prolonged thrombin time, normal reptilase time. So, ano yung mga na-discuss natin kanina na pwede mag-prolong ng thrombin time but not reptilase time? Your heparin therapy. Next naman tayo, normal PT. Normal APTT. Abnormal lang in Duchert's test. Sa Duchert's test, the only clotting factor affected is your clotting factor 13. And then next, PT is prolonged, which affects your extrinsic and common. APTT, intrinsic and common. Thrombin time, ano ulit ang dinidetect nito? Your clotting factor 1. So, anong common denominator nila? Di ba ang clotting factor 1 is a common pathway? So, mas specific ngayon ito in fibrinogen group alone. Kasi, di ba fibrinogen is also common pathway. So, analyze muna natin yung ating problem in each cases. Halimbawa, sa hypofibrinogenemia, no? Hypo means decrease levels of fibrinogen. May effect ba siya sa bleeding time, clotting time, PT, APTT, stiff vein, thrombin time, and Duchert's test? So, aralin natin yan. So, in BT, bleeding time, normal si hypofibrinogenemia. Prolong sa clotting time kasi non-specific to through all clotting factor deficiency, prolong si clotting time. PT, prolong dahil kasama siya sa common pathway. APTT, prolong. Stiff vein time, prolong dahil ang focus nito is common pathway. Thrombin time, prolong din dahil only clotting factor 1 is being detected in thrombin time. Duchert's test, normal. Dahil ito ay pang 13 lang. Okay, next naman, parahemophilia. Ano ulit ang parahemophilia? This is also known as your Oren's disease or the clotting factor 5 deficiency. So, alin dito ang nagno-normal, alin dito ang abnormal. So, halos same lang. Normal ang BT, bleeding time, yes. Prolong clotting time, prolong ang PT, APTT dahil common pathway si clotting factor 5. Stiff vein time, prolong din. Your thrombin time is normal kasi it does not detect the clotting factor 5 but only factor 1. Duchert's test is normal. Next, your clotting factor 8 deficiency or 7 deficiency. So, normal sa bleeding time. Okay? Bakit nga ba ulit normal ang bleeding times all throughout dito sa mga examples natin na to? Dahil ang bleeding time only detects the derangement in your platelets and your vessels. Okay? So, normal lagi kapag clotting factor problem. Okay? Clotting time is prolonged. PT is prolonged dahil kasama siya sa extrinsic. Normal sa APTT, stiff vein time. Normal sa thrombin time. Normal sa Duchert's test. Next is hemophilia A or factor number 8. So, bleeding time is normal. Clotting time, prolonged. PT is normal. APTT is prolonged. Stiff vein time is normal. Thrombin time, normal. Duchert's test, normal. Your von Willebrand disease. Von Willebrand disease is an autosomal dominant problem of your factor 8, right? So, tingnan natin ang results. I-analyze natin. Prolong sa BT or bleeding time. Naalala nyo yung discussion natin last time? Von Willebrand is actually disease of von Willebrand factor, which adheres in your GP 1B, 1B, 5, and 9. Right? And kasama to sa ating platelet adhesion. Okay? So, kapag abnormal nga ang platelet, the affected test will be your bleeding time. Walang affectation sa others. Bakit kaya? Kasi dalawa yung ating factor 8. Right? Yung isa, galing platelet, ay yung isa, galing liver. And kapag ang abnormal lang is yung sa platelet function, ongoing pa rin yung ating coagulation dahil meron pa rin other source of your clotting factor 8, which is in the liver. Okay? Dalawa yan, nasa endothelium or nasa may liver. Next, your clotting factor 9 ang affected sa hemophilia B, right? B9. So, normal si bleeding time, prolong si clotting time, normal si PT, prolong si APTT, normal stiff vein, thrombin, and Duchert's test. Next group of problems naman tayo. Okay, factor 10 deficiency. Normal ang BT, prolong CT, clotting time, prolong ang PT, APTT, and stiff vein kasi common pathway. Normal thrombin time, normal Duchert's test. Next naman, hemophilia C. Ano ang clotting factor deficiency dito? Your 11. Okay? So, normal bleeding time, clotting time, prolong, PT is normal, APTT prolong, stiff vein, thrombin, and Duchert's test are normal. Next naman natin is factor 12. Normal BT, clotting time is prolong, normal PT, prolong APTT, normal thrombin, Duchert's, and stiff vein, thrombin, and Duchert's. So, halos parehas si 11 and 12. Next, heparin toxicity naman. So, normal si BT, okay? Clotting time is prolong, PT normal, APTT prolong, okay? Bakit prolong sa APTT? Kasi, di ba, yung APTT is used solely for heparin therapy. Your PT is for warfarin therapy. Stiff vein time, normal. Thrombin time, prolong. Diba? Ang thrombin time is ginagamit for heparin therapy, while your reptilase time, hindi ginagamit. Duchert's test is normal. Okay, warfarin therapy naman, normal BT. Okay? Prolong clotting time, prolong ang PT dahil ang warfarin inhibits your 1972 na group, right? Tapos, normal sa APTT, stiff vein time, normal, thrombin time, normal, Duchert's test, normal. So, the best test for warfarin therapy is PT. Sa DIC naman, DIC is a problematic condition. Lahat derange. Okay? Kasi it affects all. May platelet consumption, uubusin niya yung platelets mo. Okay? So, prolong din ang BT. Uubusin din niya yung mga clotting factor. So, halos lahat derange. Except your Duchert's test. Kasi si Duchert's pang clotting factor 13. Bakit hindi nauubos si clotting factor 13? Dahil sa DIC, hindi na-form yung ating fibrin clot. Okay, agad nadudurog yan. So, walang chance na magamit mo si 13 to stabilize that clot. Okay, factor 13 deficiency, lahat normal except your Duchert's test, no? The only test for factor 13 deficiency. Okay, ito naman ang exciting part, substitution test. This is a method to identify a specific clotting factor deficiency using different types of specimen. Okay? And then, paano mo i-interpret ito? So, ito yan. Yung failure to correct a test, no? Halimbawa, PTE, PTT, ibig sabihin, nandoon yung missing problem. No? Halimbawa, prolonged CPT, normal CEPTT, practicein natin. 'Di ba sabi natin yung prolonged or abnormal result nandun yung missing. So dito, saan ang missing? So we have extrinsic common, intrinsic common. So tanggal na si common dahil nag-normal sa APTT. So tanggal din si intrinsic. So ang problem natin is nasa extrinsic pathway. So, ganito ang substitution test. Okay, di ba nabanggit ko nga gumagamit ng iba't ibang reagents or specimen for the substitution test. So, gagamit tayo ng normal plasma, which is present lahat ng mga clotting factors. Adsorbed plasma, present lahat except your 1972, yung 10, 9, 7, and 2. H serum naman, present lahat except your 1, 2, 5, and 8. Kung naalala nyo kanina. Okay? So, in summary, adsorbed plasma, absent 2, 7, 9, 10. H serum, absent ang 1, 2, 5, and 8. Okay, try natin isolve bawat possibilities, no? So, lahat yung pwedeng matanong, isa sa mga to, no, sa substitution testing. So, tandaan lang natin, ang deficient clotting factor ay nandoon sa not corrected na substituted plasma. Okay? Not corrected. Dapat yun yung focus natin. So, unahin natin itong first problem. So, ang first problem natin ay normal ang PT, prolonged APTT, adsorbed plasma is corrected, H serum is not corrected. Interpret natin yung results. So, again, your PT, ang ibig sabihin ng normal PT, correct ang extrinsic and common pathway mo. Prolonged APTT, incorrect lang ang intrinsic pathway lang dahil this nga sa PT, common pathway is corrected. Okay, sa adsorbed plasma naman, correct daw ang levels of your 2, 7, 9, and 10. Kasi nga na-correct. Okay? Ibig sabihin, okay lahat ng levels. Sa H serum naman, no, dito ang focus natin, not corrected. Incorrect either yung 1, 2, 5, and 8. So, paano natin gagawin ito? Alin dito sa apat na to yung intrinsic pathway lang. So, ang clotting number 1, factor 1 is common. 2, not included yan. Huwag natin i-consider yan. Dahil, sabi sa adsorbed plasma, corrected. Right? So, tatanggalin na natin yan. Yung possibility na yan. 5, common pathway pa rin yan. Yung 8 is intrinsic pathway. So, the final answer, ano ang missing deficiency? It is the clotting factor 8. So, gets ba? So, meron pa tayong problem. So, the problem is prolong ang PT, PTT is prolonged, adsorbed plasma is correct, H serum is not corrected. PT, ang ibig sabihin ng prolonged PT is incorrect ang extrinsic or common pathway. APTT, incorrect yung intrinsic and common pathway. So, ang problem natin nasa common pathway. Okay? So, possible na ito lang ang problem natin. Kasi in both PT and APTT, nagkaroon ng derangement. Next, sa adsorbed plasma naman, corrected, right? So, correct ang levels of your 2, 7, 9, and 10. Sa H serum naman, incorrect si 1, 2, 5, and 8. Pero ang focus natin is common pathway. Alin dito ang common pathway? 1 is common. 2, not included. Bakit not included? Dahil nga doon sa adsorbed plasma, corrected na si 2. So, tatanggalin na natin yung possibility na ito ang deficient. 5 is a common pathway. 8 is intrinsic. So, ano ang problem natin? Ang missing factors ay either 1 and 5. Pero hindi matatapos dyan, no? You proceed to thrombin time to correctly identify which of the two is deficient. So, sa thrombin time, magiging prolong ang thrombin time if factor 1 nga ang deficient. Magiging normal kapag factor 5. So, dito, ang final answer will depend on your thrombin time results. Next naman, normal PT. Prolonged EPTT, adsorbed plasma is not corrected, H serum is corrected. PT is correct, is normal, so correct ang extrinsic and common pathway. EPTT, incorrect, intrinsic only, kasi yung ating correct common pathway is corrected in PT. Adsorbed plasma, sabi natin not corrected, so deficient ang levels of either 2, 7, 9, and 10. Ang H serum naman natin correct, so hindi natin consider si 1, 2, 5, and 8. So dito tayo magpo-focus ngayon sa ating adsorbed plasma clotting factors. So alin dito ang intrinsic pathway? 2 is not included again kasi yung H serum natin, corrected daw si 2. So, tanggal na natin yung possibility ng 2. 7 is extrinsic. 9 is intrinsic. 10 is common. The final answer would be clotting factor 9. Another problem. Prolonged PT, prolonged EPTT, adsorbed plasma is not corrected. H serum is corrected. PT, so ibig sabihin incorrect ang extrinsic or common pathway. APTT, incorrect ang intrinsic or common pathway. So possible na common pathway ang problem kasi ito yung common denominator nila. Next, adsorbed plasma is not corrected. So either the problem lies in your factor number 2, 7, 9, and 10. H serum, correct daw ang levels ng 1, 2, 5, and 8. So, alin dito sa mga ito ang common pathway? So, 2 is not included. 7 is extrinsic. 9 is intrinsic. 10 is common. So, the final answer would be your factor 10. Next naman, prolonged PT, prolonged EPTT, adsorbed plasma is not corrected. H serum is not corrected. So, sa PT, either extrinsic and common pathway is problematic. EPTT, either intrinsic or common. So, possible common pathway kasi ito yung common denominator natin. Adsorb plasma, incorrect daw in 2, 7, 9, and 10. Each serum, 1, 2, 5, and 8. So, ang problem natin is common pathway. So, alin dito sa dalawang ito, no? Ang mga common pathway. Ano ang common denominator nila? So, 'di ba, ang factor 2, yung common denominator ng dalawang specimen. So, possible na nasa factor 2 ang problema dahil ito rin ay common pathway. Next naman, prolonged PT, normal APTT, adsorbed plasma is not corrected, H serum is corrected. PT, incorrect either extrinsic or common. APTT, correct daw ang intrinsic and common. So, ang problem is possible extrinsic pathway. Sa adsorbed plasma, baka nandun sa 2, 7, 9, and 10. H serum, correct daw ang levels ng 1, 2, 5, and 8. So, ang focus natin, alin dito sa mga to? Ang extrinsic pathway. So, 2 is not included dahil corrected ang H serum. 7 is extrinsic. 9 is intrinsic. 10 is common. So, the missing factor would be your factor 7. Okay, normal PT, prolonged APTT, adsorbed plasma is not corrected, H serum is not corrected. So, correct daw ang cutting factors of extrinsic and common. Prolong cutting factors of your intrinsic and common. So, possible, nasan ang problema? Intrinsic pathway. So, nasaan ang problem? Tingnan natin yung mga adsorb and age specimen. Adsorb plasma, incorrect daw si 2, 7, 9, and 10. H serum, incorrect si 1, 2, 5, and 8. Pero, alin dito sa mga yan ang intrinsic pathway? So, ang common denominator nila is 2, right? Pero 2 is common. So, itong result nito is deranged or not possible. No? Hindi mo ma-identify dahil ang problem nga natin lies in the intrinsic pathway. Pero ang common denominator nila is 2. So, not possible ang results na ganito. Okay? Next naman, normal PT, prolonged APTT. Corrected ang adsorbed plasma. H serum is corrected. PT, correct ang clotting factors of extrinsic and common pathway. APTT, incorrect daw si intrinsic or common pathway. So, the possibility lies in your intrinsic pathway. So, tingnan natin adsorb and H serum. So, correct ang levels ng 2, 7, 9, and 10. Correct din ang levels ng 1, 2, 5, and 8. Pero, kung babalikan natin, no, yung ating corrected part na to. Kasi ito lang ang yung cutting factor that would result to corrected adsorbed plasma and H serum kung pagbabasihan natin tong table na to. So, either 11 or 12 ang answer. So, compatible ba ito sa PT-APTT results natin? Intrinsic ba ang 12 and 11? It is intrinsic. So, tama yung answer natin. Iwan ko muna yung substitution studies, no? Di ba na-discuss naman natin yan back in midterm. Proceed tayo with mixing studies naman. And of course, i-discuss natin ulit yan in SEM 2, part 2 ng HEMA. No, di-discuss natin yan lahat. Babalikan natin yan lahat. Mixing studies naman tayo. So, anong ginagawa in mixing studies? Sobrang haba na itong process. Mas maganda kasi i-discuss natin para mag-gets nyo rin kung bakit ganito yung interpretation ng result. Okay? In PTT, partial thromboplastin time, if prolonged, okay, you can proceed to mixing studies. So sa first muna tayo, okay? Kapag PTT ay prolonged, you can proceed with thrombin time. Okay? Kapag ang thrombin time mo ulit ay prolonged, maglagay ka ng extra reagents such as your Hepzyme. Hepzyme means, it will bind to heparin present in the patient plasma. Okay? Kasi ang heparin can prolong both PTT and your thrombin time. So, i-rule out mo, baka naman may heparin, madami siyang heparin or may prolonged heparin therapy. So, gamit kang Hepzyme. So, i-repeat mo ulit ang PTT mo. Kapag nag-normal, ibig sabihin, ang may kasalanan nga doon sa bleeding condition is heparin. So, heparin overdose ang final diagnosis mo. Okay? Pwede kang mag-assay for heparin pero still maganda na tong parameter to diagnose heparin overdose. Okay? Kapag naman yung thrombin time mo is normal, okay? Pwede ka mag-proceed to another test. You mix plasma with normal plasma. Yung patient plasma mo, i-mix mo with normal plasma. And then, kapag ang result is uncorrected, hindi na correct ng normal plasma, ibig sabihin, mataas ang chance na meron siyang lupus anticoagulant, which is one of the antibodies of your APAS. So, kapag APAS, PTT is prolonged, thrombin time is normal, pero kapag na-mix na siya with normal patient plasma, uncorrected pa rin ang PTT or prolonged pa rin ang PTT. Okay? APAS yan. Next, if in case nag-mix ka ng normal plasma, na-correct siya, okay, you proceed to next test. You mix a patient plasma and normal plasma and you will incubate it at 37 degrees Celsius for 1 to 2 hours. Repeat PTT ka. Kapag corrected na or normal na yung PTT, baka clotting factor deficiency. Okay? Next, kapag uncorrected pa rin yung PTT mo, baka merong specific factor inhibitor or anticoagulant or naka-anticoagulant therapy siya. Okay? Masyadong mahabang process, 'di ba? Medyo nakakawindang, pero still, pwede ka na rin mag-proceed with mixing studies. Sa mixing studies, kaya siya tinawag na mixing kasi after testing for PTT, you mixed it with a normal plasma. Ano ba ulit ang meron sa normal plasma? It contains all of your clotting factors. Okay? So, paano natin i-interpret yung mga test results in mixing studies? Unahin natin, ito. Prolonged thrombin time. Okay? PTT is corrected after Hepzyme. Ano ba yung Hepzyme na yan? It is an enzyme which degrades your heparin. So, pag tinanggal ni Hepzyme yung heparin dun sa blood specimen, okay, and na-correct yung PTT mo, ibig sabihin, may heparin compound yung blood specimen. So, more or less, you assume that there is a heparin overdose. Next naman, PTT is prolonged and not corrected after normal plasma. So again, kapag laging not corrected yan, lupus anticoagulant. Next, PTT is prolonged. PTT is corrected after incubation of normal plasma. Ibig sabihin, meron tayong clotting factor deficiency kasi nga the normal plasma contains all clotting factors. Kapag minix mo yan with the blood specimen at na-correct, ibig sabihin may clotting factor deficiency nga. Okay? Next naman, PTT is prolonged. PTT is not corrected after incubation of your normal plasma. Ibig sabihin, meron kang either anticoagulant excess or ano yung na-discuss natin kanina, baka mayroong acquired hemophilia. Ano nga ulit ang acquired hemophilia? Autoantibodies against your clotting factor 8.